In this 45 patient population of cisplatin-ineligible metastatic urothelial cancer patients, just want to highlight a couple of things. 84% patients had visceral metastases and 31% patients had liver metastases out of those. And majority of patients had lower tract urothelial cancer. 1/3 had upper tract disease. And we saw that the median duration of treatment was 7 months, and patients received a median of 9 cycles. And in this study, at even 4 years of follow-up, 40% patients remain on study, meaning they were alive and being followed. The responses seen on this study were 73.3%, and this is the first time that we reported the blinded independent central review responses. Previously, the investigator-assessed responses were reported, and the concordance was over 95% between the investigator-assessed and blinded independent central review. Complete responses were 15.6% and 58% partial responses. 11% patients had stable disease. Durability was a key result that we saw. Median duration of response was 22.1 months, and 47% patients were without progressive disease or death at 24 months, and the tail of the curve holding really nicely. And we saw that progression-free survival also was very impressive. At 12 months, 55% patients were progression-free, and at 24 months, 41% patients were progression-free. Median PFS was 12.7 months. Again, the tail of the curve was the highlight. Median overall survival was 26.1 months, and at 24 months, 56.4% patients were alive. We did not see any new safety signals than what has been previously reported. The most common adverse event of any grade, the top 3 were peripheral sensory neuropathy in 55.6% patients, fatigue, and alopecia. And grade 3 or higher lab abnormalities or adverse events, which were most frequently seen, were increase in lipase, which was not clinically significant and did not mean that patients had pancreatitis. Rash, fatigue, these were the most common ones. One patient died from multi-organ dysfunction in the context of bullous dermatitis. And rash was particularly common with, especially attributed as an adverse event of special interest for EV. And majority of the rashes were maculopapular rash. And the skin reaction and the hyperglycemia tend to occur early on within cycle 1, around that time, and does improve with adequate dose modification, dose reduction, or withholding the doses, and resolves pretty quickly too at a median of 1.2 to 1.6 months. Peripheral neuropathy, on the other hand, occurs a little later by 3rd cycle, and it takes about 7 months to resolve if adequate dose adjustments are made. And this underscores the importance of doing a very thorough physical and history and physical exam so that dose adjustments can be made and patients don't get serious toxicities. For pembrolizumab, we did not see any new safety signals. However, I would like to note that the severe skin reactions were reported at higher incidence when pembrolizumab was combined with EV, and rash that was attributed specifically to pembro was 24% any grade and 22% grade 3 or higher. Patients also underwent subsequent therapies, including systemic therapy, palliative radiation, surgeries, etc. And many patients actually just continued on one of the 2 agents. Subsequent therapy was pembrolizumab or EV, which really meant that they stopped the other agent due to some reason. And not all of them came off due to disease progression. Some of them came off because they had a complete response and they didn't want any further treatment, or they were undergoing consolidative surgery. So that was the reason for treatment discontinuation in some patients. In summary, there's a high unmet need for patients who are cisplatin-ineligible and have metastatic urothelial cancer. And the EV-103 dose escalation cohort A safety profile was very manageable with no new safety concerns, even on 4-year follow-up. The responses are consistent with what has been initially reported, and the durability and the duration of response are really key here with impressive PFS and OS. And the benefit will further be seen in the phase 3 study that has been completed, the EV-302, where this is being combined to patients who got gem-cis or gem-carbo. So even cisplatin-eligible patients are allowed in that, and hopefully we'll see the data in future, and we're looking forward to that.